HealthEd is Australia's leading provider of quality clinical education for doctors and other healthcare professionals. This episode has been made available on Spotify and Apple Podcasts. For free access to the full library of podcasts and to claim CPD for listening, visit healthed.com.au or download the HealthEd app.
I will be speaking to Dr. Alexandra Metse on the importance of sleep for preventive health. Dr. Metse, tell us about yourself.
My name is Alex. I'm a clinical psychologist and academic at the University of the Sunshine Coast. I guess to give a little bit of background relevant to the topic of the importance of sleep for preventative health, I started my research and clinical journey about a decade ago and was really interested in health inequities and the role of behavioural risk factors. And as a clinical psychologist, I was particularly interested in health inequities for people with mental health conditions. And so the focus of my PhD research was around smoking and mental health and how we might be able to support people with various mental health conditions to quit smoking, both to improve their physical health, but also to improve their mental health outcomes. And so I guess as time went on and I started on my postdoc journey and I had to do my registrar program for the clinical psychology training, I got the sleep bug, so to speak. And so I became really passionate and interested in sleep. And in my clinical practice, I had to do lots of continuing professional development. And I started to really seek out opportunities to learn about sleep, because I was finding when I was working with people that sleep seemed to be a really important thing, both for their physical health and for their mental health and their mental health treatment response. So alongside my clinical work, in my research, I started to investigate a little bit more and started to become very interested in the research that existed at the time around the relationship between sleep and both physical and mental health outcomes. And that's really been a focus of a lot of what I've been doing over the past 5 to 10 years now. So, and here we are talking about it.
A very simple question to start with. Why is sleep important for health?
That is a great question. And I guess healthy sleep really, it plays a vital role in good health and well-being across the lifespan. So we know that broadly when we're sleeping, the body's working to support healthy brain function and to maintain physical health. It's really replenishing and repairing itself through cell and tissue growth, while also enhancing its ability to maintain energy balance. So I guess a little bit more specifically, we know that there are many physiological systems that have very specific and essential functions that occur when we sleep. And these systems include those that govern cardiometabolic, immune, neurological, endocrine, and mental health function. So a lot of systems at play. And we know as a result of this that healthy sleep's really critical for things like growth, healing and immunity, and for learning, memory consolidation, attention and problem solving. And really importantly, and some of the things that I really noticed in my clinical practice is how important it is for emotion regulation. And it's also a lot of my research has been focused on it's how protective it can be against many diseases and disorders. And I'm sure we'll talk a bit more about that as the podcast progresses. But I just wanted to really highlight that the really fundamental importance of sleep for health has been highlighted in the last 10 years through its acknowledgement of one of 3 core pillars of health. And so the 3 core pillars of health have been noted as sleep, diet, and physical activity.
That is just a great setup for us, because I'm going to ask a very simple question next, Alex. If sleep is so vital, then how do you define what is good sleep or poor sleep?
Yes, that's a great question. And it's actually quite complex to define what poor sleep is. So I was going to suggest we start by defining what healthy sleep is as a way of helping us understand what poor sleep is. So I was part of a working group to develop a policy brief to improve population sleep health in Australia, run by the Mitchell Institute and the Sleep Health Foundation last year. And it was interesting because there was a group of experts nationally that came together, and we certainly grappled with the idea of what is good sleep, and it took us a little while to come up with the definition. But the definition that was included in the report was high quality sleep that's sufficient in duration and follows a consistent schedule that aligns with an individual's natural circadian cycle. Healthy sleep should also facilitate attentive wakefulness and daytime functioning and meet the individual's subjective assessment of good sleep. So the definition really contains lots of dimensions that need to be considered when we're defining and assessing for healthy sleep. So the first one that I think most people sort of jump to is sleep duration, or the time that we sleep in a 24-hour period. The next one is quality. So we know that there are many indicators of sleep quality. One of them is the self-reported satisfaction with sleep that someone has. Another really common indicator of sleep quality is what we call sleep efficiency, or the proportion of time that someone's in bed trying to sleep that they're actually asleep. And that's a really good indicator of quality. The definition also talks about this concept of consistency. And when we're talking about consistency, we're talking about the timing of sleep in the 24-hour day and the need for that timing to align to someone's circadian preference or chronotype, as well as night-to-night variability in the timing and duration of sleep. So we know based on the research that variability is often quite poor. So people might sleep at a certain time through the week, for instance. So they might go to due to many different reasons, they might go to bed quite late and then have to get up early for work. And then on the weekends, they might get up a little bit later. They might sleep in to try and catch up on sleep. And we know that would mean their sleep wasn't that consistent according to our definition. And I guess the last thing that I really wanted to highlight in the definition, that they talk about those kind of outcomes of sleep. So things like alertness during the day and daytime functioning, or the ability to perform tasks productively and effectively in our day. There's a lot to consider, isn't there, when thinking about what healthy sleep is. I guess just while we're talking about this, I wanted to sort of highlight that the definition really speaks to the idea that healthy sleep isn't just merely the absence of a sleep disorder. So thinking about the kind of World Health Organization's definition of health and it not merely being the absence of disease, healthy sleep isn't just merely the absence of a sleep disorder. And this definition is really nice in that it accounts for the many people who experience poor sleep that may not ever meet the criteria for a formal sleep disorder. So coming back to your question, what is poor sleep? It's when someone's sleep is of suboptimal duration, quality, or is inconsistent. Most severe cases of poor sleep are, of course, sleep disorders such as insomnia and obstructive sleep apnea. But we could conceptualize poor sleep on a continuum between suboptimal sleep, characterized by that insufficient or excessive duration or poor quality at one end, the milder end, through to sleep disorders at the more severe end, if that makes sense.
Makes a lot of sense, Alex, because I've been speaking to many others who seem to concentrate on specific sleep disorders, from insomnia to sleep apneas. But you are the first one to say, look, David, just because you don't have these two doesn't mean that your sleep is necessarily of high quality. What is going to be tricky here is that knowing now that these sorts of lower quality or poor quality sleep does impact us on so many levels, there are some criteria that you've mentioned that is not difficult as a GP to elicit from our patient's history, but there are some that are a little more difficult, which is like the quality of sleep, self-report sleep and sleep efficiency, where it becomes a little bit harder for us to assess.
Absolutely. And it's not as simple as how many hours do you sleep? But thankfully, there are some very brief, validated tools that can be used in clinical practice now. And I can speak to those a little bit that can support primary care clinicians and physicians to be able to do some screening, which could then inform some digging deeper if required. Yeah.
Those resources are invaluable to us. So we might, at the end of this podcast, talk about resources and tools and how to use and how to access them.
Yeah, absolutely. Sounds great.
Now, you have mentioned the huge dimension of, how poor sleep affects our health. To be more specific, though, what are the major health problems that does come from poor sleep?
There's been a really large increase in research in this space over the past decade or so. And we know that broadly, people can experience both physical and mental health problems due to poor sleep, both in the short term and the long term.
Mm-hmm.
So in terms of physical health in the short term, we know that poor sleep can significantly increase the risk of high blood pressure, weight gain, and an impaired immune response, which of course then increases our vulnerability to getting sick from things like bacteria and viruses.
Yep.
It can also increase in the short term the risk of heart attack among people with existing cardiovascular issues, and also of engaging in other health risk behaviours like smoking, not exercising, eating fast food, and engaging in excessive alcohol consumption. So there's that kind of flow-on effect in terms of other health risk behaviours when we're thinking about poor sleep. We know that poor sleep also has immediate impacts on cognitive processes. So I think most people have had a rough night of sleep at some point in their life. So you can probably guess what some of these things are. But we know that there are prominent impacts on things like memory, concentration, attention, and decision making. And it's these impacts coupled with those really salient feelings of fatigue or sleepiness that can lead to accidents, so both at work and motor vehicle accidents, and can also increase the risk of falls, particularly among older people. I guess just very generally, poor sleep in the short term can very quickly impact people's just general functioning at work and in relationships more broadly. And then lastly, in terms of mental health in the short term, we know that people who are experiencing poor sleep are much more likely to experience stress and quite severe levels of stress, more likely to report things like somatic pain, low mood and irritability, a generally lower quality of life, and higher levels of emotional distress. Really importantly, though, to note that poor sleep in the short term and long term is a significant risk factor for suicidal ideation and behaviour, particularly among adolescents and adults that are already at higher risk of suicide. So those that have a history of suicidal ideation or behaviour. So it's a particularly important thing to have on our radar in that context.
I am rather gobsmacked, Alex. It's a huge and long list that really impacts every part of our lives, really. I'm really concerned about the last bit, though, because we have this wave of mental health issues in our younger people. And we also know that when you have a mental health issue, your sleep is the first thing that kind of goes, and you engage in all sorts of things and stay up late. And basically, there's a lot of variability in your sleep patterns. And now you're saying that this itself increases the risk for suicidal ideation. What a problem.
I know. Yeah, absolutely. Absolutely. And it's just not something that we can, it's so important. It's not something that we can't miss this, because it is the evidence is really quite strong that are supporting people with mental health difficulties.
Alex, you've also red flagged some important things for people in significant positions who make decisions that affect other people's lives. or
Mm.
make significant decision that affects corporate health, if you like, or
Mm.
organizational viability.
Mm.
And yet these people are often under stress, working very long hours, probably going to bed late. And you tell me that this affects both their cognitive function and their decision making. Is that true?
Yeah, absolutely. Absolutely.
You're
So
painting a pretty amazing picture here, Alex. We're going to talk a little bit about it.
there's really very strong evidence now of the relationship between the various dimensions of poor sleep. So when we're talking about quantity, quality, consistency, and those outcomes of sleep, with various longer term health outcomes. So in terms of mental health, we know that poor sleep is a very significant risk factor for mental health disorders like depression and mood disorders, anxiety disorders, substance use disorders, PTSD, and psychosis. And importantly, so not only does it increase the chance of someone developing one of those conditions, when people have those conditions, it also can impede the treatment outcomes for standard mental health treatments. So I remember working with a client when I was doing my registrar program, and this was part of the reason that I became so interested in sleep. And I remember working with a client who was presenting with difficulties after a fairly significant trauma. And we were using cognitive processing therapy, which has a very strong evidence base. It's quite a standard psychological treatment for trauma-related symptoms. And the client wasn't responding to the treatment as we might have expected. And when I say we, I mean myself and my supervisor, my clinical supervisor at the time. And I remember my supervisor very wisely said, "What's going on with their sleep?" And asking about what was happening with their sleep. And they had recently been to some training and had reviewed some literature that highlighted the importance or how sleep can get in the way of people being able to engage and respond to standard mental health treatments. So suggested that I treat their sleep first using CBTI. So I did. And I talked to the person about it and gave them a rationale around why that might be helpful. And they were really on board. And what happened was, one, I was quite surprised how well the treatment worked in terms of how the person's sleep improved quite significantly after CBTI. But I also noticed that without even going back to the standard trauma treatment, that many of the trauma symptoms reduced significantly after CBTI, which was quite interesting. But then once we started CPT again, so the cognitive processing therapy for trauma, their response was just exponential compared to how it was prior. So it was really interesting. And so of course the researcher in me was curious about what's going on here and why that could be. And there's a fairly strong evidence base now around the benefits of doing what I did there in terms of treating sleep first, and there's lots of trials that have investigated sequencing treatment in terms of sleep and then mental health. And certainly there are fantastic benefits. I guess in terms of thinking about why that might be, there's some hypotheses around capacity to engage with some of those higher order cognitive work when you're not sleeping well. If things like attention, problem solving, decision making is impaired when we're not sleeping well, then of course that's going to be hard to do some of that higher order work. Other hypotheses are around the impact of poor sleep on memory consolidation, and particularly in the context of trauma. We know that's incredibly important. Others talk about increased self-efficacy from the behavioural activities that form part of CBTI. And again, others sort of suggest perhaps it's related to better production of BDNF. So there's lots of potential mechanisms that could be at play here, but I guess just wanting to highlight, it's not just a risk factor for mental health disorders in and of themselves. It can also impede treatment outcomes, standard mental health treatment outcomes as well. So that's a really important thing to note. In terms of physical health and long-term impacts, we know that chronic poor sleep is linked to a lot of various cardiometabolic diseases. So things like type 2 diabetes, obesity, cardiovascular disease, and metabolic syndrome. Thinking about mechanisms notes that how poor sleep might increase the risk of these conditions. They're numerous and they vary contingent on the condition. But for example, if we're going to take obesity, there's been multiple interacting pathways or mechanisms suggested. So we know that when we're not sleeping well, production of things like insulin and our hunger hormones, leptin and ghrelin, they're not produced in the same way. So they have negative impacts on production. So people are more likely to consume more calories when they're sleeping poorly. Other hypotheses relate to the impact of reduced energy when we're not sleeping well. So when we don't have as much energy, we're perhaps less likely to engage in physical activity and to consume more calorie-dense food. So there's not one distinct reason, so to speak, or way that these things are related. There's many, but certainly the evidence is pretty solid now that poor sleep is a significant risk factor for cardiometabolic diseases. And I guess just lastly to note that the impacts on physical health and mental health aren't enough. There's also some significant risk of neurological disorders such as Alzheimer's disease associated with poor sleep. And thinking kind of on the earlier end of the age spectrum, among the littlies, we know that poor sleep increases the risk of numerous learning difficulties and growth-related issues. So really, no doubt, it's a significant risk factor for ill health.
Wow. So you just mentioned two really important points that may have huge clinical impact for GPs. So I'm going to just run through two things I think I've learned. Should we as GPs therefore screen patients with refractory mental health issues to have their sleep treated so that they will respond better to treatment? And for our patients who we class as already just having a high risk of having poor sleep or having poor sleep and a mental health issue, to actually focus first on fixing the sleep, because your story is highly compelling.
David, I think there are really wonderful suggestions. Absolutely. So seeing sleep as separate from mental health conditions, of course, it's a symptom and of many mental health conditions. And so historically it was just assumed that the sleep would resolve once the mental health symptoms resolved. And we can see this and through the various revisions of the DSM over time, where there was this classification of, for example, primary insomnia versus secondary insomnia. And now it's insomnia and it stands alone. So it's comorbid or otherwise. And so yes, I think yes to both of those questions. That would be a fantastic way of supporting people with mental health difficulties that are also having sleep problems.
And that also translates to the physical. So patients who are, if you like, not at targets with their management of all their cardiovascular risk factors, be it hypertension, diabetes, obesity. What you're saying is that in these patients, especially if they're having problems meeting targets, don't forget to also treat sleep independently.
Yes, absolutely, because it might be that poor sleep's hindering their capacity to engage in a healthy lifestyle or do other things that will be helpful. So it's a risk factor for chronic disease in and of itself, but it also has synergistic effects in terms of how it impacts other behaviours.
This episode is one of hundreds of informative and free clinical podcasts from Health Ed. Access the entire library through the Health Ed app for healthcare professionals, which you can download today from the App Store.
Alex, you've certainly got my attention, and I'm sure a lot of other GPs' attention about this. Now, the problem is it something that is so common that we're missing?
Poor sleep in Australia and internationally is incredibly common. There has been some really wonderful population level research that's been undertaken here in Australia. And this research suggests that anywhere between 40 and 65% of Australian adults will experience poor sleep. And by that, I mean sleep of suboptimal duration, quality, or consistency. So we've got a big chunk of our population who unfortunately are experiencing poor sleep. And I guess just to elaborate a little bit further, A survey we conducted a few years back that involved a representative sample of Australian adults suggested that 42% of people had poor sleep. But interestingly, 19% had poor sleep on just one of those dimensions. So that was suboptimal duration or quality or consistency. But 13% had poor sleep across two of those dimensions, and a further 11% were across all three. So it might suggest that a substantial proportion seem to have poor sleep across many of those key indicators, which may suggest quite severe poor sleep, so to speak. So it's common, and potentially a lot of people have quite severe levels of poor sleep.
Okay, because this is so important and has such strong clinical implications. We are so easy. It's so easy for us to slap on a blood pressure cuff, take your blood, measure parameters. When you complain of sleepiness, probably run some sort of tool to see if you actually have a sleep disorder. And we are managing everything in a very different paradigm. And you're shifting it for us. You're saying, you know what, David? Common things happen commonly. Sleep or poor sleep happens commonly. And it both exacerbates and maybe initiates quite a lot of mental health and physical health issues. And we are very good at identifying the issues once they have occurred. We're not very good at identifying nor treating the poor sleep quality that you're speaking about. You're really saying, change that paradigm, guys.
In an ideal world, shifting that paradigm, as you suggested, would just be incredibly helpful in addressing the really high prevalence of poor sleep that we know exists within Australia. I wanted to elaborate a little bit further, David, just in terms of how common poor sleep is. So we know that there are certain groups who are at much greater risk of experiencing poor sleep. So that estimate of 40 to 65% of Australian adults, we might see even higher prevalence among people who have chronic conditions such as arthritis, mental health disorders, as we've discussed, and who already have cardiometabolic disorders. We know women tend to be at greater risk of poor sleep, as are shift workers and people from socioeconomically disadvantaged backgrounds. So among those groups, I don't want to overinflate in terms of figures, but the prevalence can be much higher than for the general population there as well. So intervention in those groups might be particularly important.
Wow, that is a problem that it's almost like a little iceberg, isn't it? We just don't see how deep and how big it gets. So having understood that, what can be done?
Yeah. So when you say what can be done, do you mean in the primary care context? Yes.
Absolutely. As GPs, that's what we're
yes. Because lots could be done. My mind sort of was thinking across the full spectrum, but in terms of primary care, I guess a key role for primary care could be prevention and early intervention. So in terms of practices that could support that, we know standard preventative care practices. So things like routine screening for poor sleep in the context of regular health checks. Where poor sleep's been identified, things like the provision of brief advice to improve sleep and referral to specialist services where needed. I thought it might be helpful to talk this through a little bit more, David, just so that I can talk to some of those things like the tools that might help with screening and those kinds of things as well. Would that be helpful here?
Definitely.
So I guess just in terms of routine screening, as I mentioned, there are groups that are at higher risk. So we know routine screening would be for everyone, but it might be just particularly important for those groups that are at higher risk. So I think people like women, shift workers, and those with those chronic physical and mental health conditions. A really great screening tool is called the Are You Sated measure. U and then SATED. And I'd be really happy to provide a link and share the resources if that's helpful. So it screens for poor sleep across all of those key dimensions that we discussed in the context of the definition.
Mhm.
So across duration, the quality indicators and consistency. And it's a validated tool. It would take less than 2 minutes for a patient to be able to complete as part of a routine screening. I guess when we're thinking about sleep, we know that sometimes we have difficulties in our sleep as individuals that are associated with an obvious trigger, things that have happened in our life. And these sleep difficulties might just be kind of short and then resolve by themselves. So it would be really helpful if poor sleep has been identified in the context of routine screening, just for primary care physicians and clinicians to maybe just assess whether there is an obvious trigger at this stage. And if so, provide some support to mitigate, if possible, some of those triggers. So it might be things like pain, stress, bereavement, adjustment, transitions, those kinds of things that we can see people might have just a short bout of sleep disturbance following those things. And then in terms of if poor sleep has been identified, we would want to tailor our brief advice around how we could improve or address poor sleep. But I guess a lot of the time it could probably consider things like the importance of sleep for health. So, being able to suggest, be able to acknowledge all of the things we've talked about today around the links between poor sleep and various health outcomes. Some education about what normal sleep looks like, because I think that some people have expectations around 8 solid hours of sleep, and that can be a bit hard to achieve for many people, and actually doesn't represent what we know normal sleep looks like. And brief advice could also contain things like simple sleep hygiene advice. So, lifestyle changes that can be helpful to promote sleep. So regular sleep-wake patterns. I think a few people have asked me, what's the one thing you'd recommend to someone who's having difficulty with their sleep to improve their sleep? And my response every single time is set a consistent wake time and stick to it. So no matter what happens during the night, get up at the same time every day. And it's so helpful when we think about the physiology of sleep. That can be just so helpful for so many of those systems that underpin good quality sleep, having a regular rise time. So brief advice like that can be fantastic. Morning sunlight, the standard things in sleep hygiene, avoiding caffeine after 3 and benefits of physical activity, that could all fit within a brief advice kind of intervention. Some settings might have the luxury to be in the position to offer brief behavioural therapy for insomnia at this stage, if it's indicated. That's really a shorter version of CBTI that is just the behavioural components, and it is really helpful for many people that have poor sleep and doesn't require a high level of expertise for it to be able to be delivered. And I guess the last bit of preventative care, often we think assess, brief advice, and then referral. So, if someone's presenting with poor sleep, that's unlikely to be able to be managed in the context of the primary care service, referral on to a self-directed program. So there are some wonderful evidence-based self-directed programs. For example, This Way Up has a wonderful insomnia online self-directed program that people could engage with. Or in other instances, referral to a sleep physician or a clinician trained in behavioural sleep medicine might be needed.
You've mentioned 2 things that are quite interesting for me. The first is a comment that you focus on the wake time, not the sleep time. And it's interesting how often we say, you got to go to bed before 10:30.
Yeah.
But we focus so much on that and not get up at 6:30 or 7.
Yes, absolutely. Absolutely. So, and it's a bit of a shift, because yes, we're get to bed. That's a common message, I think.
Wonderful. And lastly, just a comment. You said that the normal 8 hours of sleep is something that a lot of people hold on to. My question then becomes, what happens if you have too little, and how much is too little, and how much is too much? And do they have the same problems on your health?
Yeah, fantastic. So what's the optimal sleep duration? It's a really good question. And it's certainly not a black and white or one size fits all. It really does depend. So I guess the first thing I wanted to note is that the optimal amount of sleep really depends on our age. So we know our people's need for sleep changes as we age. So generally younger people need more sleep than older people. I think it makes sense when you kind of think about kids, they generally need a bit more sleep than adults, don't they? So the recommended sleep duration for kids is about 9 to 11 hours, whereas older adults or people over 65 typically only need about 7 to 8 hours to function well. The other bit of the puzzle is that we know that for people of the same age, they can have varied sleep needs. So some need more than others to function well and stay healthy. And this is reflected in the range that we see in the recommended number of hours for each age group. So as I said, children generally need about 9 to 11 hours. So that's a 2-hour difference per day in what some might need versus others. And similarly for adults between 18 and 64, anywhere between 7 and 9 hours is recommended. But interestingly, we know anywhere between 6 and 10 hours might be okay for certain people in certain circumstances. So potentially a 4-hour variability per day. So it does make it hard sometimes in terms of assessing how much sleep is enough, or is someone's sleep duration optimal. The American National Sleep Foundation has published some duration recommendations that have been endorsed by the Australasian Sleep Association, and these recommendations are made according to age across the lifespan. So it can be a really helpful tool just to have on hand if we're asking people about their sleep duration, to be able to assess, is this person getting enough sleep, or are they maybe getting a bit too much sleep? And because, of course, we know that there are health outcomes associated with both short sleep duration and long sleep duration as well. Yes.
Do people with short sleep duration have the same health issues as those with prolonged sleep duration?
So in terms of physical health outcomes, generally the associations between short and long term are similar in terms of health outcomes. So we know that people, when we talk about short sleep duration, just as a general rule, we're talking about less than 6, as long duration for adults greater than 9 hours. So we know that durations that are short or long can lead to significantly increased risk of things like diabetes, CVD, obesity, hypertension, stroke, and coronary heart disease. But interestingly, short sleep duration, but not long sleep duration, has been associated with all-cause mortality. And some of the potential mechanisms there suggested are around telomere length and prolonged systemic inflammation. So there does seem to be some similarities in terms of the physical health outcomes or conditions for short and long, but there are also a couple of differences. And it's really quite interesting when we think about that finding around all-cause mortality.
Alex, I've had the most interesting conversation with you, and you've opened my eyes a lot. So I'm just going to ask you to both give us a summary and key messages for our listeners.
Based on what we've talked about today, really highlighted that poor sleep is really prevalent among adults in Australia, and it's a really significant risk factor for many short and long-term health outcomes. One really important takeaway message, though, is that we can support people to improve their sleep. Poor sleep is modifiable. It's a modifiable risk factor for these conditions. And there is a really important place for primary care in addressing this issue of poor sleep in Australia. I did want to sort of talk about that kind of idea of prevention and, assessment and brief advice and referral where needed, and acknowledging that some of those practices are already recommended in primary care for other health risk behaviours like smoking and poor nutrition. I believe there's a SNAP guide that primary care clinicians and physicians can use to support routine screening and brief intervention for these other health risks. And it would just be so wonderful if sleep could be added to that, to be acknowledged. It's a fundamental core pillar. It's a risk factor. And to be able to intervene in a similar way could just have so many impacts and positive flow-on impacts in terms of the health and well-being of our population.
One of the things you've agreed to do earlier was to send us a list of resources and tools that will really help GPs in this area, and possibly including areas for referral. You mentioned some. And I'm concerned that with the huge number of people with this problem, that there might not be enough resources to refer to.
That is a noted significant issue in the sleep space at the moment, is referral options, particularly for people who might need more specialised support, that perhaps referral to self-directed programs might not suffice. Very thankfully, the Australasian Sleep Association, alongside many other people and organisations, have been working really hard to address the issue of limited options for referral. So they're working to improve and significantly increase the number of psychologists in Australia who are trained in behavioural sleep medicine. So hopefully in the very short term future, there will be many more clinicians who will be putting their hand up to say, yes, I feel I've got the skills to be able to support people with sleep difficulties.
That is such good news to end on, Alex.
Really wonderful work that's been done, and really is a key piece of the puzzle in addressing some of the issues associated with poor sleep in Australia.
Alex, once again, thank you so much for both your time and your teaching.
Oh, thanks so much for having me, David.
Thank you for listening. Visit healthed.com.au to create a free account and claim CPD for podcasts like this and access a record of your learning. Subscribe to the show on Spotify or Apple Podcasts for weekly episodes on a range of clinical areas relevant to your ongoing practice.